A mother of 4 in Galveston, Texas, tragically died this week of COVID-19, 2 weeks after her husband died of the coronavirus. Neither one was vaccinated. Now, Lydia's final wish before she passed? Make sure my kids get vaccinated. But when will vaccines be ready for children like mine, who are 4 and 1? Moderna and Pfizer are still running clinical trials for children aged 5 to 12, but apparently adults are already good to go for a 3rd shot next month. Hospitalizations for children have soared. The latest figures show more than 120,000 new cases just this past week. Tens of thousands of school children are in quarantine. In Mississippi alone, that's 20,000 children. 5 kids died there this week. But rather than help protect school kids with mask mandates, which is the only way to protect people who are too young to be vaccinated, people like the Lieutenant Governor of Texas blame the spread of COVID on black people. Listen to this.
The Democrats like to blame Republicans on that. Well, the biggest group in most states are African Americans who have not been vaccinated. The last time I checked, over 90% of them vote for Democrats in their major cities and major counties. So it's up to the Democrats. They're doing nothing for the African American community that has a significant high number of unvaccinated people.
Video. Joining me now to discuss all of this is Dr. Corey Hébert. He's BNC's chief medical editor, and Dr. Kate Tulenko. She's a former director of the U.S. government's Global Health Workforce Project. Dr. Hébert, let's get your reaction to what the Lieutenant Governor had to say about the correlation between race and vaccination rates.
I don't know if I should be the person to discuss the governor's comments, because I think I might be a little bit too abrasive on the elected leader. However, I am concerned that people will take away from this that African Americans are causing the problem. We can never blame the people that are reactionary to anything in this country as to the reasons why they don't want to get vaccinated, or the reasons why they have the social determinants of health that actually make it so that African Americans don't get the monoclonal antibody for so their lives can be saved, and they don't get adequate health care, they don't get adequate schooling, they don't get adequate housing. So I'm probably the worst person in the world to actually make that comment more germane to the conversation. But what I will say is that right now we have a problem because children aren't being vaccinated, because below the age of 12 we are still in the clinical trials. But we do have children that are spreading this Delta virus like crazy, and they are in classrooms clustered more than the adults are right now, and they are the ones that are making this this thing spread like wildfire. And it's really sad, because at this point, if we don't have mask mandates in the schools, and a lot of governors are saying that they don't want to have that, then this is going to be a really hard winter with RSV, parainfluenza, influenza, and COVID-19.
Dr. Hébert, I appreciate you being diplomatic on my behalf as well, because I would not have been in your situation, because I'm having a hard time even being diplomatic about this next idea that I've been trying to wrestle with. And Dr. Tulenko, maybe you can help me wrestle with this, which is explaining to parents like me that I can get a 3rd shot, but my kid can't even get one. How do you do that?
Okay, the reason for that's not a supply issue, it's a safety and study issue. So the FDA, whenever any drug or vaccine is developed, they first test it in adults. And so we received the emergency use authorization for Pfizer and Moderna at the the end of 20 and beginning of 2021. And we will actually probably as early as next week get the full FDA approval for adults of the COVID vaccine. And probably as early as Thanksgiving, we will get the approval for the 5 to 12 age group for the Pfizer vaccine, because they're just finishing those studies. Then they'll complete the studies for the 2 to 5 years old, and then the 6 months to 2 years old, because they have to sort the children by age, because they have a different physiology and different body weight. And so this is just the standard way that any drug or any vaccine is approved in the U.S.
Dr. Hébert, you've often said what Dr. Tulenko is just hinting at here, which is that kids are not just tiny grown-ups. So there does need to be a separate process and a clinical trial procedure. But the American Academy of Family Physicians is calling on the FDA to use emergency authorization to fast-track these shots. And 100 lawmakers also called on the FDA to provide some sense of timeline. So what is the holdup? Is it the science or is it bureaucracy?
Well, we have a huge issue with bureaucracy in this country when it comes to clinical trials. I mean, I'm the principal investigator on multiple clinical trials for COVID-19 modalities at this time, and we have an issue right now. We did a story on BNC earlier today. In Charlotte, North Carolina, we can't even get Black children to be in the clinical trial. So I'm really concerned the fact that we are going to have this, and if we fast track it, we won't even really have enough Black children in the study to say that it's safe for Black people. So we have, as a group, have to be a lot more aggressive about putting our children in clinical trials. But who's going to do that as a Black parent when you, as a Black parent, don't actually have the vaccine yourself? I mean, I'm leaning a little bit more. Children are very important. But I'm looking at more the world stage, because if we give Americans the third shot, but then no other place in the world has had one shot in some of the places that we are so concerned about when we talk about these variants, when you are infected, those are the people that are going to make the variants all around the world, meaning that all of the issues come from other countries that are not vaccinated. So if we don't give them one shot and we give us 3 shots, we are shooting ourselves in the foot, because the variants are going to come here anyway. So it's a big issue. It's a moral issue as well.
Dr. Tulenko, in the 1 minute we have left, help us, bring that thread globally, because Dr. Hébert just referenced that most people in the world haven't even gotten one shot. So what do we do about that? We're trying to take care of the children here in America, but this is clearly still a global pandemic.
Exactly. As he mentioned, less than 2% of Africans are fully vaccinated. And when you look at low-income countries in Latin America and Asia, it's very much the same. And so the U.S. needs to make a decision over whether we're going to let politics lead what we do, or whether we're going to look at the greater good and decide that it's better to prevent additional variants from occurring, vaccinate the entire world rather than revaccinating Americans. But that's a very difficult decision to make. And on the children and whether or not we should push the authorizations, there's already right now just so much mistrust that for the CDC and FDA to push even emergency use authorization even faster, I'm just concerned that would cause even more distrust. And what we certainly need is more people reaching out to communities. There are a lot now apps where people can find culturally competent physicians to discuss their concerns with. Also, I highly encourage anyone in your audience to, if they have a friend who's hesitant, to talk to them about it, accompany them to the vaccination, help them sign up for the vaccination, make a day of it, and really help support them in their decision.
Well, as you mentioned, it does seem that the politics of it really falls on our children, where some people are willing to sacrifice them for their politics, and others, like myself, are just worried about their safety. Dr. Kate Tulenko, Dr. Corey Hébert, thank you for joining me tonight. More Prime after this quick break.